Are you keeping up with the latest in workplace health and safety in Australia? Psychosocial safety is now more important than ever, with new regulations emphasising the duty of care to prevent psychological harm. Join us on the 29th of August for a rapid-fire webinar hosted by two FlourishDX experts as we tackle these pressing challenges and pave the way for future best practices in psychosocial safety. Gain insights on beyond engagement surveys by learning how to more accurately quantify psychosocial risks. Discover strategies for improving the governance of psychosocial safety. Understand how to provide ongoing monitoring of psychosocial hazards and the effectiveness of controls. And determine the prerequisites for empowering line managers to take ownership of psychosocial safety. This webinar is a must for any health and safety or HR professional dedicated to creating a safer, more productive work environment. Don't miss out on this vital opportunity. Register now to ensure your organisation takes the lead in psychosocial safety. Visit www.flourishdx.com to register. See you there. Now on to this episode.
From FlourishDX, this is the Psych Health and Safety Podcast. With workplace mental health becoming a safety prerogative, this is the source of information on psychological injury prevention and health promotion.
Everyone, and welcome to the Psych Health and Safety Canada podcast. I'm Kim MacDonald, and I'm your host. And today, my guest is Dr. Leah Ringwald. And Dr. Ringwald is with the Conference Board of Canada, and she's Associate Director of the knowledge area of human capital. Welcome, Dr. Ringwald.
Thank you, Kim. Nice to be here.
Yes, I'm really excited about this opportunity to talk to you about the study that you're currently in the middle of and that you've finished this first phase. But before we get into the details of the study, I like to have everyone introduce themselves in their own words and tell our listeners a little bit about your background, your experience, and what brought you to this work.
Wonderful. I'm the Associate Director of the Conference Board of Canada's Human Capital Knowledge Area. I lead this knowledge area with my colleague, Liz Marcel. My background, so I have my doctorate in experimental psychology, and I focused my academic research on workplace stress and mental well-being. So basically, I was brought in to lead the research that comes out of the Conference Board's Workplace Mental Health Research Center, which I know we'll dig into today. And then I also oversee our inclusion portfolio. So we know there's clear intersections between inclusion and overall workplace health. So it was an obvious decision for the board to kind of have these two areas work very closely together. Prior to working at the board, I was working as an organizational psychologist in the tech sector. So this practitioner experience, I feel, has really helped me as a researcher to really get those firsthand insights and those real world perspectives around how workplaces and programs are designed and then implemented, how these kinds of programs get implemented on the ground. So that I think always helps me to consider the relevance and applicability of our research findings. So given my background, workplace mental health is a topic that's very near and dear to my heart. I've been really happy to see that's been moving up in the corporate agenda. But then it's also very clear that, even with this progress, the impact of the pandemic has driven this issue home. So it's exciting to be in this role and engage with organizations who see mental health as a priority and recognize the importance of tackling this issue using evidence-based actions.
That's great. Thank you. Thank you for that. I think this is my assumption, but I do believe that many listeners may not know the full scope of the Conference Board of Canada and the kinds of research that is available, and also the knowledge areas there is a focus. Can you share a little bit about that?
For sure. Yeah. So for those who aren't familiar with the Conference Board of Canada, so we're basically known as the country's foremost independent organization for applied research. We're a nonprofit. We're comprised of researchers and economists with profound subject matter expertise. We bring applied insights to these key focus areas. And so we have a number of them: economics, health, immigration, Indigenous and Northern communities, education and skills, sustainability, innovation, and inclusion, as I mentioned. Um, and then, of course, our human capital knowledge area. And our goal here is really to help leaders enhance their organization's strategic and competitive position as they develop and execute their HR plans. So we do this in a few different ways. We bring together timely and relevant data and insights, trends, analysis, and then we also offer peer to peer learning. So I work very closely with my colleague Liz. She oversees a lot of the research and activities we do around HR trends, compensation, total rewards, labor relations. So her side of the shop really conducts a lot of those benchmarking reports so that HR professionals can use our statistics and our insights to develop their HR strategies for the upcoming year. My side, as I mentioned, is more workplace well-being and inclusion. Those are two areas I'm super passionate about. And then we have some custom research projects as well under these two fields. And the Workplace Mental Health Center, so the research that we're talking about today actually comes through that center. And the mission here is to increase awareness and understanding of workplace mental health through research and analysis, and really tackling the most critical matters faced by Canadian organizations with regards to the well being of their employees. So we conduct rigorous research and analysis. This is backed by the Conference Board of Canada's research table. It's co developed in collaboration with our Centre Steering Committee and our Research Advisory Board members. And so our outputs include really actionable recommendations for key decision makers that are based on the robust evidence that we produce. So that's kind of a background on the board and our area specifically.
That is awesome. I have been using the Conference Board of Canada's studies and research for, it's hard to believe, but it's been 30 years. So came to it early with a few other key sort of global research sources, and it's been amazing over the years to be able to use and access it. And so I highly recommend it for all our listeners to explore some of the information that you have there already, and certainly about this particular study as we go forward, and get you back also in the fall for the other phases. So, as you know, this is the Psych Health and Safety podcast. And from your perspective, Dr. Ringwald, how would you define psychological health and safety?
Great question. So to me, psych health and safety really refers to conditions and practices in the workplace that support and protect the mental well-being of employees and really allows them to thrive at work. We'll often see, workplace policies, procedures, and practices that are minimizing psychological risk and fostering a positive work environment. So there's a lot of key elements that come into play here, but what comes to mind is having a culture where employees feel very supported by their peers, by their managers. Having those open lines of communication, very clear expectations around their roles. Another key factor, I think, is flexibility around working conditions. So, this could be providing flexible work hours or remote options that really help employees to balance work and their personal life. And then another, I think, key factor for psych health and safety would be um, engaging employees in decisions that affect their work and providing regular opportunities for them to provide feedback to their team and their leaders, and really ensuring they have a voice.
That is awesome. That is one of the best descriptions of it, and it really lays out the national standard, the Canadian national standard, well in pretty accessible terms. So thank you for that, Dr. Ringwald. That was pretty good. I'm glad we have it recorded so that I can use the summary myself. The That leads us really well into this study. And the study has a really long title, which is, I will read it because I can't remember it. So, Real Connections in a Virtual World, Designing Remote Workplaces for Social Connections. And in the lead up to this conversation, we had chatted and had, went through a host of questions. But one of the questions that I'm placing here, kind of at the beginning for a lot of our listeners, is for you to define what social connection means in this context. And then we can get into some of the methodology and some of the findings that you've had, and how we go from there.
Yeah, sounds good. So social connections really, we look at it from from a few different angles, and it encompasses, I think, a few different variables that we think really contribute to that feeling of social connectedness at work. So first is really looking at the presence and the quality of relationships among employees. So for instance, do you have friends at work, or do you have a coworker available to talk to about your day-to-day problems? We're also interested in like the social inclusion aspect. So employees' subjective feelings of isolation or lack of meaningful connections. So we would look at, do employees feel alienated or emotionally distant or disconnected from others that they work with? Are they unsatisfied with the relationships they have at work? And what we see in the external research is this subjective experience is actually a stronger predictor of mental health outcomes. Um, but we're really interested to see what our national study finds, because of course we're going to tease out a lot of these factors of social connection and then look again at how that influences mental health. But that's basically how we're looking at social connection at work.
Thank you. I think that in many workplaces, when you bring the idea up of connection or belonging, and obviously you mentioned about the related topics of inclusion and things like that, social connections, I do think that it sometimes is misunderstood. And we make sort of the jump to these other sort of, we're trying to create certain things that inside the organization so that people have an opportunity to, with health and wellness particularly, we had, we're coming through the journey of, I would say, maturity and understanding our mental health and what are the conditions and the things that are really impacting it. And, we had started in Canada and all over the world with talking about mental health from an individual perspective, and the health and wellness group inside an organization making health and wellness a priority and doing those kinds of things. So as I hear you talking, what I hear is a much deeper understanding of a person's relationship inside the workplace and those relationships and how they're perceiving both themselves inside an organization. So I'm really excited to hear more about this because I think it does shift maybe what we had, the focus and the work in terms of what are workplaces doing and how are they thinking about the social connection and what is their role in it. And from the spectrum of things, which is, no, we're here to work. This is what is my job in trying to create a better social connection. That isn't what we do here. We're here to do the work and to focus on the work. And so as we have the conversation, I'd like you to share a little bit about that because I think it does help to shift why this is a shared responsibility and why this is a shared piece of psychological health and safety. And as you say, ultimately, a person's mental health and getting to what the role, of the workplace could be in that. And maybe debunking some of those sort of that narrower version of the definition of social interaction inside the workplace. Um, the So tell me a little bit about the conference board and how it came to this particular topic, and maybe some of the other things that led to it.
Sure. So this program of research was really developed out of a need to better understand how the evolving work context was impacting social connections. And we really needed evidence-based research around this, best practices, tools, and support for organizational decision making in this area. As you just mentioned, a lot of organizations were seeing that shift in terms of, oh, we should be paying attention to this, but how and to what extent was really the question they were asking. We realized, we're in this era where virtual communications are replacing a lot of our face-to-face interactions. And when the pandemic hit, many offices that were fully in person shifted their work models to remote or to hybrid to accommodate the needs. But what we were hearing from our network of HR leaders is that there were growing concerns around how these new work contexts were impacting the connections that their employees were building at work and ultimately the mental health of their workforce. And we knew this issue of social isolation and its impact on well-being was complex and it was going to continue to evolve. So we found that it was a very important area to investigate. Um, we also saw there was really no established business case for addressing social isolation in the Canadian workforce. So, again, to your point, organizations didn't really understand their role in this. Um, and so, when we set out to tackle the topic, what we found is that there's this lack of evidence and insights to, again, the extent to which organizations should be placing around this. And then also, are there different demographic groups that may be at higher risk? And then without this robust data, there's very little guidance that we can say, here's what you should be doing and why, especially at that org level or team level. So knowing the extent of the issue in Canada and the associated costs in terms of business outcomes can really help organizations and leaders determine how much time they should be investing in mitigating these efforts, or and how many resources, of course. So we're hoping that the insights from this research can help them to develop, policies, procedures, practices that can help to foster social connections if indeed we find that that's their role. Um, and then, of course, knowing if certain employee groups are impacted more than others can help to guide more targeted interventions, which we know are more effective.
So turning to the methodology, or I guess the sections of this piece, which I guess is three pieces of this first phase. Maybe share a little bit about, did you have specific research questions that you explored?
Yeah, so it's the research program is actually divided into three phases. This first phase was divided into two methodologies, but essentially, they're all answering the same larger research questions. So we had the first one was, to what extent do social connections influence employee mental health and the business outcomes in the Canadian context? And then, of course, does this differ by different employee groups? Our second question was, what organizational level and team level strategies have been effective for building social connections in hybrid and remote work settings? And then our third was, what types of supports do employees need regarding social connection building at work? And then, do these needs differ by different groups?
So how did you conduct this phase?
Yeah, so the first phase of this research, so the report that we just produced is really kind of a primer phase. So the main goal was essentially to call attention to the topic. Before refining these core research questions, it was really important for us to do an extensive scan of the literature. So, looking at workplace social connections, isolation, remote and hybrid work, mental health outcomes. And we wanted to summarize basically what's the evidence that's out there in the literature. And what we found is that a lot of the research that had been done is actually international research. It's not conducted with Canadians. And we, as part of this primer piece, we also conducted a small survey that we sent out to Canadian HR leaders. And this was just to kind of get a pulse check and really examine what practices organizations are implementing to foster social connections in the workplace. What are the key challenges that they're facing around this? And then whether they're assessing the effectiveness of these initiatives and how they're doing that. So that allowed us to kind of apply a Canadian lens to the research topic in advance of doing this large national survey.
Hmm. So what were the findings of the lit review? Like, or the end of the survey? Yes.
Yeah, I'll talk about some of the findings from the lit review, and then of course some of the key findings from what we heard in the employer survey as well. Through the lit review, we learned that lack of social connection has been linked to employee mental health and productivity outcomes. Again, this is in more of the international research. So, employees that feel lonely, they're more than three times as likely to be dissatisfied with their jobs. And employees who are able to fulfill their social needs at work are more committed to their organizations and tend to be more engaged. Um, we also saw that loneliness has profound effects on well-being. We saw individuals who are engaged in fewer social interactions and have less social support at work than desired tend to experience lower levels of mental health. People who interact less with others report lower levels of mental health, and providing opportunities for social interactions does improve well-being. Um, we also saw in the external literature that people who feel lonely miss more days of work and are more likely to leave their jobs than workers who feel socially engaged in their workplaces. Um, and then, of course, the research, like a main finding for us, was that the Canadian research on this topic was very limited, and most of the research on remote work and health outcomes was conducted pre-pandemic or during the pandemic. So we really didn't have those fresh insights. Um, our survey of Canadian HR leaders, we asked again around what practices they were implementing. We heard that the two more popular practices were around encouraging regular check-ins from leaders. So almost all of the organizations in our sample were trying to do this, and then promoting in-person social events. So nothing super groundbreaking there. And then organizations who had different work arrangements, so they had people working in person and remotely, they would try to overlap in-person work days among their team members so that people could interact with each other in person. In terms of challenges, the majority cited that trying to manage busy work schedules, so excessive workload or having too many meetings was kind of the key barriers that they were facing to encouraging social connections among their employees. And we hear this often, I'd like to connect with my colleagues, but I'm in back-to-back meetings all day and they have to be very work focused. So there's just not a lot of time to catch up about each other's weekend or kind of connect on a personal level. And half of our respondents from HR leaders reported that the need to build initiatives that accommodated workers and different work arrangements was a challenge for them. They hadn't quite figured out how to do that.
Well, I can hear as you're sharing that some of the risks. So those employers that are looking at, business risks and some of a risk management framework, whether it's a psychological health and safety or, which includes some of those business issues around retention and around productivity and motivation, and, building trust and, belonging and all those other kinds of issues that are important inside organizations. It opens up it connects a lot with a lot of things, doesn't it?
Do you need more psych health and safety in your life? Then head over to the FlourishDX Academy for several free on-demand e-learning courses. If you're an internal professional, follow FlourishDX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the FlourishDX Academy. www.45003.org. Now back to this episode.
Dr. Ringwald, can you share a little bit about what the conference board has done in this area in terms of other pieces of research that are connected or linked, or you see as you continue into the fall, into the next phase, that would continue to link into this work?
Yeah, so there were some previous studies that our human capital research team had worked on that kind of provided this interesting jumping off point for this program of research. Um, Of course, I mentioned this earlier, but we knew that social connections were top of mind for organizational leaders, and we knew that they were grappling with decisions around return to in-office work, hybrid arrangements, and then what those impacts would be on mental health. So in November of 2022, our Workplace Mental Health Center published a report on future proofing investments in workplace mental health. This is available on our website. I can also link it in the show notes. But this project essentially looked at how employers were supporting their employees' mental health and how their mental health and wellness strategies really shifted over the course of the pandemic. Um, we know that the pandemic really underscored the importance of mental health and wellness. And so we saw organizations really accelerating their efforts to more holistic and adaptive approaches to employee health and well-being, and really increasing their suite of health and wellness initiatives to help their employees better transition through the pandemic. And so, a survey that we conducted with Canadian organizations as part of the project showed that concerns around social connectedness were very much top of mind. Um, so more than 80% of those we surveyed were worried about employees feeling disconnected while they were working online, sorry. And above 80% were also worried about employees' loss of relationships and their interactions at work. And then almost 80% reported having concerns about the risk of remote employees feeling disconnected or lonely outside of work. So again, this kind of fed into this growing concern that we were seeing across the board. And then last year, in one of our benefits benchmarking reports, we saw that 96% of Canadian employers were offering their employees the possibility of working from home at least some of the time. And we also saw that hybrid work arrangements were the most prevalent work model across organizations in different sectors and different industries. Um, so, this was likely one of the reasons organizations were really considering the fate of social connections, as they realized that this physical coexistence was really not the norm for most employees anymore. And what exactly that meant in terms of mental health, they weren't sure, but they were concerned.
All right. I can see, that when we think back to the pandemic and some of the research that was done, and it's good. Thank you for that, because bringing it forward, it's still relevant, because now we've created a different model where maybe it's not 100% working from home or remote, but there's these hybrid models, and working through that and using some of that good research. So absolutely, I'll take those links, Dr. Ringwald, and I'll put them in the show notes, and so folks can access them, and or go to the conference board. But the links will be there. Other, could you share a little bit about what I guess the research did so far in terms of what are the needs of employees?
Yeah, that's an interesting question. And again, something we're really going to dive deeper into in this national survey. But if there's a clear takeaway from the primer piece, it's that we know from the research people have different needs for relatedness and belonging. We know that loneliness is not a consequence of people having a lack of social connections per se, but it's really this mismatch between what people need and then what they're actually getting from others. So this creates a little bit of a conundrum for organizations, because there's this challenge in creating an environment where people have the opportunity to seek the amount of social support and interactions that they need. So there's really not this one size fits all solution, like most cases with organizational wellness, but figuring out how they can properly tailor and customize their supports with social connections is kind of key to the next phase.
Yes, that's going to be a very big challenge. It's a challenge now in conversations I have, which is trying to from a system perspective for organizational change, not that we have individual needs as well as common needs, and how to make some changes. And managers are pressed right now, and middle managers and supervisors. So trying to figure out what are the strategies they can use. So I'm really looking forward to the fall too, so that we can have that conversation and really get into some of the advice for workplaces. Okay, as we move forward, what advice would you give based on what you've heard? Maybe we can move into that a little bit and get from you how workplaces and leaders can use what you've shared today.
Yeah, so, you know, I have to really wait for this next phase of research before providing more tactical recommendations from our data. Um, what I can say is there's currently a clear lack of guidance on how organizations can effectively manage social connections. But what we do know from the research we've conducted so far is that organizations can work to prevent loneliness by ensuring employees have time outside of work to engage in meaningful personal relationships. We know relationships at work are important to employees, but they're really only one part of the social connectedness equation. We know that individuals typically turn to their personal life, so their friends, their family, their neighbors, their community, to fulfill most of their social needs. And so there's some research that's been done through Dr. Kiefer Card at Simon Fraser University, and he's looked into this as well. So it's really important to for organizations to be mindful that they can't solve all of the challenges related to loneliness by offering opportunities by just offering opportunities for people to connect at work, but it's also giving them enough work life balance so that they can leave work and go fulfill those needs as well.
It is it's to help employers create some common strategies, but also to be understanding of different people are at different phases of their life and they have different needs as well. And that kind of loops back to this flexibility issue that you had started out when we talked about and why the model's in place, why the hybrid model, and why employees like that hybrid model. So there's no easy answer. I can see that. However, I do think there's all kinds of creative ways that organizations can also create psychologically healthy and safe work environments that, support social collaboration and cooperation and other elements of that social piece, which is people working together and let the work do the work. So when you work together, you are basically having social interaction. So we can chat, and I know that you have more to share on that as well. Um, I, I love hearing that it's a bigger, deeper, broader question than, maybe the way we looked at social interaction in the past. Um, and with the complexity aside, is there anything else that you'd like to share about, with our listeners around this topic?
Around social connections or
Yes,
just
yeah.
kind of
Social
reducing.
connections. Yeah, and reducing loneliness, I guess, or increasing. I guess there's that two pieces, Dr. Ringwald. It's mitigating the risk, but also moving beyond risk to creating the conditions so that whatever those conditions are that would support human thriving and flourishing, and that work is a piece of our lives, and work typically for many organizations is through people working with other people. And I think it's just moving into that, we're working to eliminate risk, but we're also actively creating conditions. And so I just wanted you, if you had anything more that you wanted to share on that social connection, whether, for, is it, where is it in the priority list, I guess, in terms of helping to create those conditions? How important is it?
Yeah, I think that's super well said. I think it kind of speaks to this broader approach that organizations are now shifting to, and it's taking a more holistic approach and view of supporting employees inside and outside of the workplace. So social support and social connection is really one pillar, but you also have to consider things like health. Are people getting enough sleep? Financial wellness, all of these factors that kind of move beyond what we traditionally think of in terms of that line between employees, what organizations should be supporting, and what they shouldn't be. It's really trying to create an organization that supports the whole person, and that's going to look different for every organization, but realizing that if people want to show up to work and bring their best selves to work and really thrive, they have to feel supported in and outside of the workplace and all those different aspects of their lives.
Great. For the next phase, what's the timing on sort of the next pieces, and remind our listeners what the next phase is, and then some of your timing?
Yeah. So the next phase of the research is actually already kicked off. So we're working on this large national survey. The survey tool's ready. It's going to go out in the field, and we'll be collecting that data over the late summer. We anticipate we'll have preliminary results in the fall, hopefully a report published later in the fall as well. And then our hope for phase 3 is to dig a bit deeper into those nuances through some qualitative methods. So perhaps speaking to managers in Canadian organizations who work with remote or hybrid teams and really getting at building on the insights that we get from the from the quantitative data piece, and better understanding like what they're doing, what they're thinking, and how things are actually working on the ground.
Very good. So we will have you back for a conversation once those reports are complete. And for those folks who want to reach out to you, how can they get in contact with you?
Yeah, so my contact information is available on the Conference Board of Canada website. So I'd encourage you to also check out our Workplace Mental Health Research Center website. We can link that in the show notes as well. And that has all of our previously published reports. And then, of course, the Human Capital Knowledge area on the Conference Board website has all of our other great human resource research reports, our Spotlight series, where we showcase Canadian organizations doing really innovative things. So there's a lot to kind of tap into there. So I'd encourage everyone to check that out and get in touch if they're interested in learning more.
That's great. And to our listeners, thank you for listening in. And thank you to Flourish DX, the sponsor of the podcast. And I'm always looking for topics, guests. Reach out to me on LinkedIn or at 13 Factors. And until next time, that's all for now.
You've been listening to the Psych Health and Safety Podcast. To stay up to date with the latest on psychological injury prevention, follow Flourish DX on LinkedIn and subscribe to the Psych Health and Safety Podcast at www.psychealthandsafety.com.